Hi, my name is Heather Bowers. I'm with Lone Star Benefits. I am the group benefits broker for Trusted Medical, and I'm here today to go through your employee benefit program. For those of y'all that this is open enrollment, this is your time of year to enroll in the plan, to make changes to your plan, to add dependents, drop dependents, things like that. And if you are watching this as a new hire later on during the year, this is also your time to take advantage of the benefits offered by Trusted Medical. So what you should have in front of you is your employee benefit guide. That's what I'm holding as well, and that's what I'll be going through today as we talk through your benefits. So, as you can see on the front of the guide, the policy year is August 1st of 2020 through July 31st of 2021. So one big thing to know is that even though the policy renews August 1st, your medical deductible does not start back over until January 1st. And so the plan year and the deductible year are separate. So when you enroll in the plan, if you're enrolling for the first time as of August 1st, your deductible will start August 1st, and then it will reset on January 1st. Same thing if you're already covered right now, your deductible is just going to continue through the rest of this year, and then it will reset on January 1st. So keep that in mind as we are going through the plans today. So we will go on and flip through to page 3. And this page is just going to talk about who's eligible for the plan. So it's going to tell you that you can enroll, your legal spouse can enroll, any of your children that are legal dependents of yours are able to enroll in the coverage. And again, for those of you that are new hires, your waiting period is first of the month following your date of hire. So that is when you'll be able to take advantage of the benefits as well. And then it just kind of talks through how to enroll as we go through this. So each of you will have a custom enrollment form. And so that's the form that you'll use to make your plan elections on. So turning now to page 4, it talks through how to make changes. So if you've been covered by insurance before, you'll probably recall that once you enroll in the coverage, you cannot change it until the next open enrollment. So any elections you make as of either August 1st, which is the open enrollment date, or if you're a new hire, as of your effective date, those will be your plan elections that will be in place until Trusted Medical renews again next August 1st. So again, as you're looking at the plans, make sure you pick plans that choose how you need to use the benefits this year. As you're looking through who to cover, maybe dependents, make sure if you think they're going to want coverage during the year that you add them now, because once your plan elections are made, the only way you can change your benefits throughout the year is if you have a qualifying event. And there's a list of those at the top of page 4. It could be anything from having a child, maybe a spouse loses another job, things like that. That would give you a qualifying event window to then make changes to your Trusted Medical plan. When those things do happen, you have 30 days to make a change to your plan. So let's use the birth of a child. If you have a baby, make sure that they get added to your plan within 30 days. If they don't, the insurance carriers won't allow us to add them after that 30 days until we get to the next open enrollment window. And the same thing if you lose coverage through a spouse, just keep in mind throughout the year, you always have that 30-day window to make changes to your plan. So where we will, actually, let's go in and flip to page 5. And that's a lot of words in writing, kind of the plans that you have available for your medical options through Trusted Medical. So if you are currently covered under the plan, they are staying with Blue Cross Blue Shield, and the plan designs will be the same. However, again, this is your time of year. If you want to switch plans, you can. So at the top of that page, it just talks about, again, the insurance carriers, Blue Cross Blue Shield of Texas. All 3 plans are in their PPO network, which is great because that will give you in and out of network benefits. And then down the second half of the page is going to talk about the health savings account. So Trusted Medical will continue to offer a health savings account as one of their plan options. And this will go through kind of how the health savings account works. The chart at the bottom is a great example of what you can use your HSA funds for. And we'll get into HSAs and what that means as we go through this meeting today. So as we flip the page to page 6, this is where we'll probably spend the majority of our time. These are your 3 different medical plans available to you as an employee of Trusted Medical. Again, all 3 of them are with Blue Cross Blue Shield and all 3 on the Blue Choice PPO network. This is Blue Cross's largest national PPO network. And so if you are outside of Texas, if you're traveling, if you're on vacation, something like that, there definitely is a national network that Blue Cross is in. So you can always still use the coverage. Of course, as we all know, if you stay in network, your benefits are going to stretch much further than if you go outside the network. And we'll talk through that as we go through the chart. So at the top of each column, you'll see the website for Blue Cross. It's that bcbstx.com. On that website, you can do a provider finder. So if you're trying to find providers that are in network, just go to that website. When you get to the drop down, make sure you select the Blue Choice PPO and as the network, and that's going to give you all the providers in network. So we'll go through this very first column, and that will refamiliarize yourself with terms, with how the plan works, and then we can kind of talk through the differences with the other 2 columns. So in that first column, you'll see the plan name is the G652CHC. The in-network deductible is $1,500 for an individual. If you go outside the network, it's 2 times, so it's $3,000 deductible. If you cover your family or dependents, it's a $4,500 deductible. So what that means, that's obviously 3 times, 1,500 times 3. If you have more family members than 3, I hate using this example, but let's say you're all in a car wreck, you all end up in the hospital. Once 3 of you have satisfied that $1,500 deductible, the rest of the family deductible is satisfied. So your additional family members won't have to meet any of their deductible because at that point you have satisfied the entire family deductible. The out-of-pocket maximum, and you'll see an asterisk next to where it says out-of-pocket max, and down at the bottom, that's going to tell you that the out-of-pocket maximum is going to include your deductible. It's going to include office copays, co-insurance, prescription copays. Basically, any covered services that you pay during the year will go towards that out-of-pocket max. As an individual, once you've paid out $5,000, Blue Cross will pay 100% the rest of the calendar year. So remember, all of this is calendar year. So, if you meet your $5,000 out-of-pocket max between now and the end of 2020, at that point, as of January 1st, it's going to reset, and your deductible will reset, your out-of-pocket max will reset. For the family out-of-pocket max, it's $14,700. And again, in an example where your entire family meets that, once you've paid out $14,700, Blue Cross will pay 100% of covered charges the rest of the calendar year. If you look really quick where it says out-of-network, it says unlimited. What that means is if you do use an out-of-network provider, you're going to have that out-of-network deductible. If you look in the section above that, it says $3,000. You're going to pay your $3,000. Then if you go to that co-insurance section, after you pay out $3,000, Blue Cross is going to pay 60% of your claims. You're going to pay 40% unlimited. So that just means you're never going to hit a max to where you don't have to pay your claims anymore. You will, the whole rest of the calendar year, be sharing in those claims with Blue Cross at that 60%, 40% co-insurance. So ideally, anytime you can try to stay in network, that's a great thing because you will see that you're going to have those maximum caps that you'll have to pay. The next row down is your co-insurance. So co-insurance is where you're sharing in the cost of the claims with Blue Cross. So we'll use an example, assuming you stay in network. Let's say you go into the hospital for surgery. You're going to pay your $1,500 deductible. After that, Blue Cross is going to pay 80% of your claims. You're going to pay 20% of those hospital claims, again, until you've hit that $5,000 out-of-pocket max. So your co-insurance is just sharing in the cost of the services with Blue Cross. And the co-insurance will kick in after that deductible is met. The next line down talks about additional deductibles. On this first plan, there are no additional deductibles beyond your major medical, so we'll skip over that. The next section down is the main section that most of y'all will probably stay in. This is kind of your everyday stuff. So you'll see for a regular physician office visit, there's a $30 copay. A regular physician is going to be your family doctors and your pediatricians. Any doctor beyond that will fall under that specialist tier, and the specialist copay is $60. The next line down is on your preventive care. So I hope each and every one of you are taking advantage of this benefit. As part of the Affordable Care Act, all preventive is covered at 100%. So ladies, that's going to be your well woman exam, your preventive mammograms. Men, that's going to be your well exams, preventive colonoscopies. For any of you that cover your children, it's going to cover all of the child well visits. And again, assuming it's coded as preventive, it's covered at 100%. So before I get away from this, let me talk on a couple things that I see as a result of how this benefit works. So number one, on mammograms, I get this call frequently throughout the year. So if you go in for a mammogram and it's coded as preventive, it's paid at 100%. But let's say they find something in the image, and so they call you and they ask for you to come back. When you come back for that second mammogram, they are going to code that as diagnostic. At that point, because they're trying to diagnose you for something, it is going to go towards your deductible. So keep that in mind on mammograms. If you come back a second time, it's always going to be diagnostic. One thing I would highly recommend, ladies, is when you do go in for your mammogram, ask them that day what the most in-depth mammogram is that Blue Cross will cover. As of today, they will cover a 3D mammogram. So the idea is if we can get a much better image the first time, they're going to hopefully prevent you from having to come back for a second mammogram because they would have been able to get really good images that first time. So keep that in mind on mammograms. The other thing on the well visits. So I would say 50-50 doctors do this. If you go in for your well visit, typically they're going to ask you, has anything changed? Do you have any issues you want to talk to the doctor about? And as soon as you tell the doctor something that's going on that's outside of preventive care or outside of a well visit, many of those doctors are going to file that claim as a diagnostic claim. And so at that point, it would go towards your office visit copay, assuming you're in network. So I don't want to discourage you from talking to your doctor about anything going on with you, but just keep in mind that if you do go through anything going on with you besides just your normal well visit, there is a chance they'll code it as diagnostic and you would have to pay that copay. If you do ever go in for a service that you assume should be preventive and you get a claim, I'll point out in the guide where my information is, you're welcome to reach out to me in my office and we can guide you through what you need to do to have that claim reprocessed. Typically when that happens, it's just a coding issue. The front office just put the incorrect code and it triggered the claim to be paid as diagnostic. Assuming it was truly meant to be a preventive claim, they can always refile that claim with Blue Cross with the preventive code where it is paid at the 100% benefit. The other thing that's included in your well benefit or your well benefit is the preventive lab work. So when you go into the doctor each year for your well visit, they always run that full panel of lab work. That is covered at 100%. One thing I will talk about, and again, I just try to share tips and tricks of what I see going on out there when I'm doing benefit meetings, is that a lot of doctors are starting to do hormone testing when you go in for your well visit. So hormone testing does not fall under that preventive guideline. And so just be prepared if your doctor does want to do kind of a hormone panel to see what's going on with your hormones, that is going to go towards your deductible. I say that just because hormone testing can be extremely expensive. I've seen claims run from probably about $800 to about $2,500 in lab work. And so if you do have a doctor that wants to do all of that, I would recommend having them reach out to Blue Cross ahead of time, having the lab reach out to Blue Cross ahead of time to find out how much it's going to cost you to have that lab work done, because you may decide you want to hold off on that depending on the cost of that. However, if it's the full panel of lab work that they typically run, that would fall under the 100% benefit. The next line down is on diagnostic lab and x-ray. So this is when you go into the doctor and they're trying to diagnose you on something. So maybe you go to the doctor and you tell them, I'm tired all the time, I'm not sure what's going on. They will most likely do lab work. And at that point, since they're trying to diagnose you, it is going to go towards your deductible first. So assuming you're using in-network, an in-network lab, you'll still get the Blue Cross discounts, but just keep that in mind that, again, any of that lab that they do will go towards that medical deductible. Same thing with x-rays. If you go in and just do, maybe a broken arm, they do an x-ray in the doctor's office, that will also go towards your major medical deductible of $1,500 on this particular plan. The next row down is your imaging. So you'll see, again, where it says the 20%, that's going to be the deductible and then the coinsurance. So just like the diagnostic lab and x-ray, the expensive imaging, CAT scans, MRIs, things like that, will also go towards that deductible and then your coinsurance. So my recommendation on that is if you do find yourself needing an MRI, for example, you can absolutely shop around for those services. A personal example or a personal story, my daughter needed an MRI on her back a few years ago. We went to Children's in Plano and they were going to charge $1,700. We literally went catty corner to a freestanding imaging center and it was about $450. And since those services do go towards that deductible, anytime I can save you money, I love to. And so if you find yourself needing that, feel free to shop around. If you don't know who to go to or who to call, again, feel free to reach out to my office and we can help you find some lower cost imaging centers that will save you some money. The next line down is on your urgent care. These are going to be kind of the minute clinics, things like that. You'll see it's a $30 copay if you go to one in-network. And then for the emergency room, it's going to be a $400 copay at the time of service, and then it's going to go towards your deductible and your coinsurance. Down at the bottom is the prescription benefit. You'll see that there's preferred pharmacies and non-preferred pharmacies. So the main pharmacies that fall in that preferred tier are going to be Walmart, your HEBs, which aren't really in this part of town, Market Streets will be preferred, and Sam's Club. Any other pharmacies are going to be non-preferred. So you can still use other pharmacies, just know you're going to have a little bit higher copay. One thing for sure with all of these plans, CVS is not a recognized pharmacy with Blue Cross. So if you go into CVS to get a prescription filled, they will fill it for you, but you'll be paying the full retail cost of that drug. And so please do not go into CVS to get your medications filled because you will pay a whole lot more than if you use, a preferred or a non-preferred pharmacy. So that's kind of how the first column works. So on the second column, you'll see that it's just a higher deductible, higher out-of-pocket max. The coinsurance is a little bit different. Other than that, the plan's going to operate the same way as far as how it works. You're just paying more as a member than you would on that first plan. One thing I will point out on that middle plan, if you go kind of halfway down the page where it says additional deductibles, on this plan, we'll use the example of a inpatient admission to the hospital. You're going to have your $3,000 deductible. And then because you're being admitted into the hospital, you're also going to have that extra or that additional deductible of $250 if you're in network. If you have outpatient surgery, same thing, that's always going to go towards your major medical deductible. So you'd have your $3,000 deductible there. And then you would have that $200 outpatient surgery deductible as well. So one thing on these plans, like I said at the beginning, you should be able to find plenty of providers in network since this is Blue Cross's largest PPO network. However, there will be times that you find yourself with an out-of-network provider when you didn't choose to. Usually those times are going to be when you're in the hospital, and they call them your wrap doctors. So it's your radiologist, your anesthesiologist, and your pathologist. They are typically, when they're tied to a hospital chain, not in the network. And so what you can do on those situations, let's say you do have a surgery, here comes the anesthesiologist, they have to be in the room, and so there's no incentive to them to be in a network. And you didn't choose the anesthesiologist, it's just whoever's on call at the hospital that day. And then you're staying overnight, and so they're gonna do some lab work while you're there, and so pathology reports. If you start getting out-of-network charges or claims for those services, again, feel free to reach out to my office. I'm happy to get with Blue Cross, see if we can't get Blue Cross to reprocess those claims as in-network claims, since it was out of your control who came in and did the anesthesiology for you, or who read your pathology reports or your radiology reports. So those would be times I'm happy to help and see if we can't get it recoded, again, in order to try to save you some money. And then the very far right column, this is going to be your health savings account compatible plan. So you'll see, kind of looking through this column, it is a pretty straightforward plan in that until your medical deductible is met, there are no plan benefits with the exception of preventive care. So on all of these plans, preventive is covered at 100% from day one. But everything else on the HSA, you're going to have to meet your deductible first. So if you go to the doctor, for example, for a sick visit, you're assuming you stay in network, you're still going to get the Blue Cross discount for being in network, but you're going to be paying for that visit versus having a copay like you do on the other two plans. So for kind of your everyday doctor, it seems like office visit copays on an HSA for just the doctor visit typically are run around probably $75 to $90. And so you'll pay that, and then that amount you pay is going to come off of your $5,000 deductible. So let's say it's let's just say it's a $100 doctor visit. And so instead of having a $5,000 deductible left, now you have a $4,900 deductible left. The other time with the way the HSA plan works is going to be your prescriptions. So same thing, you're going to meet your deductible first, and then Blue Cross is going to pay 100%. So if you are contemplating the HSA, which personally I love health savings account plans. My family, we've been on one for probably 7 or 8 years. Once you get used to how they work, they're great. And we'll talk through some of the benefits of participating in an HSA. But usually the number one, if I do get a kickback from someone, it's on prescriptions. Because again, instead of having these prescription copays, you're paying the cost of that medication, and it is then going towards your deductible. So if you're looking at the HSA and you do take medications, I would recommend reaching out to the pharmacy and just ask them, like, if you were on an HSA type plan, how much your medications would cost you, because that might help you decide if you want to do the HSA or you don't want to do the HSA. One thing my family uses a lot on our HSA is GoodRx. Most of you have probably heard of it. It's an app on your phone, so it's just like GoodRx. You can also go to their website, goodrx.com, and it is a prescription savings plan. Depending on the cost of the medication and the type of medication you're filling, I have seen many where it's cheaper for me to use the GoodRx discount drug plan than to run it through insurance. However, please keep in mind, if you do use GoodRx, so you'll take your app, you go into Kroger and say, here, I'm going to fill this prescription through this GoodRx app. Kroger is going to take the information off the app, and that's how they're going to apply the discount. Just know that whatever you pay for those medications at that point, that amount will not go towards your Blue Cross deductible, because GoodRx and Blue Cross don't sync up. And so while you may get tons of savings on GoodRx, just know that if you spend, $500 in prescriptions using the GoodRx app, that $500 is not going to go towards your major medical deductible. That's the biggest thing on any of the drug cards that I would, encourage you to kind of be cognizant of. However, outside of that, again, looking at this plan, same thing, kind of like the other plans, you would have that $5,000 individual deductible. As a family, it's $10,000. And then if you go to that coinsurance, you'll see that once you've paid out that deductible, Blue Cross is paying 100%. So as an individual, your worst case scenario on this HSA is $5,000. Once you pay $5,000, Blue Cross pays 100%. Now, the great things about an HSA, they are governed by the IRS, and the IRS will allow you as an employee, if you want, to elect a certain amount to come out of every paycheck, and that amount is deposited into a health savings account that you own as the employee. And the beauty of all of that happening is it can come out pre-tax. So kind of like your payroll deductions come out pre-tax, anything that you want to put into your HSA will also be pre-tax. And so where that's going to help you is it's going to lower your taxable income. So you're not having to pay as much of taxes because that money is going into your account ahead of time. And then where it helps you is then when you do go to use the money in your HSA account, you're using pre-tax dollars. And so kind of like I mentioned, the chart at the bottom of page 5, with an HSA, you can use it for many things beyond just basic medical care. You can use it for dental work, for vision work, medical massages. There's all sorts of things that you can use those HSA funds for. And again, you own the account. So the IRS for 2020, as an individual, if you're covered as employee only, you can put up to $3,550 pre-tax into your account. If you cover family members or even one dependent, you can put up to $7,100 a year pre-tax into your account, and you own that account. So let's say you leave employment with Trusted Medical, that account goes with you. You will never lose the funds in your account. Many people confuse this with a flexible spending account. These are totally different type of accounts. With an HSA, the money rolls year after year. So you could put the full amount this year, the $3,550 into your HSA this year and not even touch it. And then in 2021, start putting more money in your account, and the funds from this year will roll to next year. And then maybe next year you have a big claim, and then you can just use that money in your account to pay for that claim. With the HSA, it is administered by HSA Bank. They're one of the largest HSA banks here in the country. If you set up an account, they will send you a debit card that's linked to your account. So when you do go into the doctor, assuming you have money in your HSA account, you'll have your Visa debit card. And so when they tell you, okay, the cost of the visit today is $75, you can just run that HSA card. That money is going to come directly out of your account and cover your claim. Same thing if you go to the pharmacy, you can run that card. For sure on an HSA plan, you would want to hang on to your receipts. So anything that you use your HSA dollars for, just put the receipts in a file, hang on to them. In the event the IRS ever does audit you, you can give them the receipts to show that everything you spent your HSA funds on were qualified medical expenses per the IRS. You can also go online and Google, it's called Section 213D, like the letter D, expenses, and that's going to give you a huge extensive list of all of the things that the IRS will allow you to use HSA funds for, in addition to just your basic medical. Again, my contact information is in here, and so after you watch this video, if you have any questions at all, or if you want to talk through the HSA a little bit more with me, I'm more than happy to help you. So just reach out to me and we can go through that. So as we flip to page 7, this is going to be your payroll contributions. This is the page that most employees typically want to go to first to see what they will have to pay for the coverage. So these plans are going to be in the same order that they were listed on the benefit, medical benefit page. And so you'll see the G652, what the payroll deduction is, and then so on and so forth. You will see that being an employee of Trusted Medical, you have a generous contribution that they are applying towards your care. In that, the middle plan and the HSA are paid 100% by the employer for your employee-only benefit. So this would be a great opportunity if you're used to budgeting maybe $200 a month for insurance. You could enroll in that HSA plan and then just take that $200 that you would otherwise be paying and have that put into your HSA account for you. On the G652 plan, the employer contribution has been applied to that as well. And so you'll see for $47.95 per payroll, you can have that richest plan design that they offer. So we will flip on to page 8 now, and you will see this is your dental benefit. So this year, as of August 1st, Trusted Medical is moving your dental benefits to Principal. They're a large national carrier. They have a large national network. So kind of like with medical, you should be able to find providers that are within the network. One huge benefit that Trusted Medical has done for this year is you will see that you now will have a $2,000 annual maximum for your dental work. For you as an employee, you'll have $2,000. If you cover your dependents, they will also have $2,000. That is the most that Principal will pay for any of your dental benefits. If your benefits exceed $2,000, assuming you're a network, you will still get the network discount, but you will just pay for that out of pocket. So we will talk through this chart and how the benefits work. So you'll see for an annual deductible as an individual, you do have a $50 deductible. If you cover your family, it's a $150 deductible for the family. Again, the annual maximum is $2,000. This past year, it was $1,000, so that's definitely an enhanced benefit that they put in place for you. And then for preventive, that next section down, that's going to be kind of your everyday stuff. That's going to be your basic cleanings, your basic x-rays. They are covered at 100%. And this will give you and any of your covered dependents 2 cleanings per year covered at 100%. So you won't have to pay anything at all for those cleanings. That also, again, includes your basic x-rays. If you have children, it's going to cover their fluoride. One thing that I will touch on before we move on. So especially here in the Metroplex, I'm starting to see more and more dentists that will tell their patients that they need to do a deep cleaning. Deep cleanings are filed with the insurance carriers as a cosmetic cleaning, and they are not covered under any of the carriers' insurance plans. So if you do go to a dentist that says you need a deep cleaning, before I would allow them to do anything on your teeth, I would ask them to submit a pre-authorization to Principal just to see if Principal will cover it, which I can tell you as of today they won't, but it never hurts to send a pre-authorization just so you know. And it seems like the deep cleaning ranges of claims that I see range between about $500 and $900 a cleaning. So if you were to get that done and Principal does not cover it, the dentist is going to bill you for that service. And so just try to stick to kind of that basic cleaning, the cleaning we all grew up with, and that is covered at 100% again. The next section down is going to be your basic basic section of benefits. Your $50 deductible would apply towards this. And the main thing that people are going to have done in this section is going to be fillings. If you cover your children, space maintainers or sealants would also fall under that benefit. But for most people, it's going to be fillings. And you'll see that Principal covers that at 80%. And so what would happen if you go in for a cleaning is you go in for your cleaning, it's covered at 100%. They tell you, let's say you have a cavity, you go back in for that. At that point, you're going to meet your $50 deductible. And then Principal is going to pay 80% of that claim, and you're going to pay the other 20%. Again, until total, they've paid out $2,000 for the year. Everything else is going to fall under that major tier, and it's covered at 50%. So again, Principal would pay their 50%, you're paying the other 50% until total they've paid out $2,000. At that point, the claim is just going to fall to you to pay. One thing that I would highly encourage you on dental work is, well, a couple things, is to do a pre-authorization for any services beyond just a basic cleaning. And then the other thing would absolutely try to stay in network whenever possible. Why the pre-authorization is so important. It's going to protect you for a couple reasons. First, that way Principal's going to look at the claim, they're going to go back to the dentist and tell the dentist your portion that you owe and then the portion that Principal's going to pay. And so based on what you have done that day in the dentist office, you may or may not want to have that cleaning or that service done because of what you're going to have to pay. And so it's going to protect you financially there. And then the second thing is it's going to protect you that you, indeed need the work done. So for example, an employee of another client of mine last year went into his dentist. The dentist said he had 15 cavities. So he called me and asked what he should do, and I had suggested he go in and get a second opinion from another dentist, which he did, and that second dentist did not find any cavities at all. And so what would have happened, had he have had all 15 of those filled at the first dentist, that dentist would have filed his claim with the insurance carrier. They would have also sent a copy of the dental x-rays, because with every dental claim that's filed, a copy of the x-rays goes with it. The carrier would have looked at his x-rays and seen that he had no cavities, and then it would have been between the employee and the dentist on who was going to pay that claim, because at that point the carrier would not pay it. And so by doing a pre-authorization ahead of time, it just protects you, because then the dental carrier can see that yes, you do indeed need the work done, and then what their portion is going to be that they pay versus what you will pay. And dentists are used to submitting pre-authorizations, so they know how to do that. A lot of them will automatically send it in, but if they don't, I would just ask them before they do anything beyond a cleaning if they could do a pre-authorization so you know what you'll owe. The next row down is going to talk about out-of-network. So just like with medical, you can go outside the network. Just know that when you go outside the network with dental, Principal is reimbursing that claim at 90% of the usual, customary, and reasonable charges. So what that means is every insurance carrier looks at all the dentists within a geographic area and comes up with what they consider the usual charge for every single service done in the dentist. So, and that's what they pay the reimbursement on. So let's say you use an out-of-network dentist, you go in for a crown, that out-of-network dentist says it's going to be $5,000 and they submit that to Principal. Principal may look at it and say, you know what, the usual and customary that we think for a crown is $1,000 based on what all the dentists in this area charge. And so they're going to reimburse that claim at 90% of the $1,000. So they're going to pay $900 for that claim. And then that out-of-network dentist is going to balance bill you the rest of that $4,100. So you can see how expensive an out-of-network claim would be based on how much that out-of-network provider charges. And then down at the bottom of that page, same thing, you'll see your payroll deductions. Again, just like the medical, Trusted Medical provides a very generous contribution as an employee, and they will cover your dental at 100%. So if you enroll in the benefit, you won't have to pay anything at all for employee only. And then if you want to cover your dependents, you'll see what that amount would be per paycheck. And moving to the next page, page 9, this will be your vision coverage. So just like with your dental, Trusted Medical has moved to Principal this year for vision. Towards the top of that chart, you'll see the network is the VSP Choice. And so Principal rents the VSP Choice network. That's also a large national network. Tons of providers are in that network. You should be able to find plenty of providers that you would want to use within the VSP Choice network. And the benefits that we'll look at on this page are your in-network benefits. So you can go outside the network, just like with your other coverages, but you will only get certain allowances that Principal will cover up to for each service done. Once they've paid out their allowance, anything out of network, you're going to have to pay on top of that. So if you can stay in network, just like everything else, your benefits will stretch further. So for an eye exam, you'll see it's a $10 copay in network. For lenses, it's a $25 copay. For contacts, they will give you a $150 allowance and then a 20% discount off the balance above and beyond the $150. If your contacts are medically necessary, it's a $25 copay. And then for frames, you will also get that $150 allowance and then that 20% discount off the balance. And you can get an exam, new lenses, and new frames every 12 months on this plan. And then at the bottom, you'll also see the very generous payroll contribution applied to vision, in that Trusted Medical is paying 100% of employee only for vision as well. And if you cover your dependents, what those portions of the premium will be. So the next page, on page 10, this is a brand new benefit that Trusted Medical is providing to every employee that's eligible for benefits as of August 1st. And this is a basic life and accidental death and dismemberment policy. The benefit amount is $20,000. So in the unfortunate event of a claim, whatever beneficiary you have listed on your enrollment materials would get a $20,000 benefit from Principal. On the beneficiaries, so on your enrollment form, there will be a spot for you to list a beneficiary. If you want to list 2 or 3, you can list all of them and just make sure you put the percentage of the benefit that you would want to go to all of them. So maybe you're going to list your 2 children and you want each of them to have a 50% benefit. Just make sure you indicate 50%. So again, in the unlikely event of a claim, Principal knows how to pay out the proceeds on that. Another thing on beneficiaries that I always like to touch on, in the event of a claim, Principal is going to come to Trusted Medical and say, who is the beneficiary listed for this individual? So you want to make sure if anything changes in your life that you update the beneficiary with Principal, with Trusted Medical. So for example, maybe you list a spouse right now and you go through a divorce in a few months and you no longer want that spouse listed as your beneficiary. If you'll just update that with the HR department here at Trusted Medical, that way we have an accurate beneficiary always on file for you. And so again, this is a great benefit they're providing to you. And so you'll have that information on your enrollment form as well. And then moving to page 11, this is just all of your basic contact information for your plan. So it's going to list the carriers' websites, their phone numbers. Typically, you're going to see the policy numbers, but with us just moving your group to Principal, the policy numbers haven't been issued yet. So you're not going to see anything for those just yet. And then down towards the bottom, you're going to find my information. Again, my name is Heather Bowers. You'll see my email address, my office line, and then also the account executive that's assigned to you that's within my office. I can't stress enough that we are always here for you throughout the year with anything that you may need on your benefits. If you have questions on benefits, if you have claims frustrations or claims questions, feel free to reach out to us. I know all of you are extremely aware of HIPAA because of the industry you're in. As an insurance broker, I also have to comply with that in order to have a license here in the state of Texas. And so anything that you talk to me about, I can work as your advocate to get involved with the carrier to get it resolved for you without ever having to involve anybody from Trusted Medical. So anything that we discuss is kept in my office. It's not brought back to your supervisor here. However, again, I can be your advocate to get involved with the carrier as I need to. So moving on through these pages, we're not going to spend a lot of time. These are just brochures for you to look through as you have time. But pages, 12 and 13 are going to be the preventive list from Blue Cross. It's going to outline all the benefits that fall under that 100% benefit that we talked about earlier. On pages 14 and 15, this will tell you how to access the Blue Access for Members website on the Blue Cross, on their Blue Cross website on the members portal. On the portal, you can request ID cards, you can print a temporary ID card, you can look at your claims, download explanation of benefits. For sure, if you ever reach out to me on a claims question, one of the first things I'm going to have you do is send me your explanation of benefit from that claim. And so you can kind of familiarize yourself with the portal. Blue Cross of Texas also has an app you can load on your phone, and then your ID card is right there on your app as well. So when you look at pages 16 to 18, this is going to outline more about a health savings account and how they work. It's going to give you a little bit more information. It's going to talk again about the tax benefits to having the health savings account set up. As I mentioned earlier in this video, if you have any questions on the HSA, feel free to reach out to me. I know a lot of people, when they haven't used one before, they're leery of it. They want to talk through their, specific examples of how they typically use care. And so I'm more than happy to talk to you on that as well. Pages 19 and 20 are just going to provide you some definitions of the terms we talked about, coinsurance, deductibles, things like that. So if later on you're trying to remember how all of that works, you can reference these pages. And then starting on page 21 through the rest of the guide is just all of the legal information that Trusted Medical has to provide to you as an employee that has benefits. So a couple final points. Again, this would be your time of year to enroll. Just remember, anything that you elect is going to be your election for the next plan year. Again, unless you have a qualifying event that would allow you to make a change. You can pick and choose how you enroll your benefits. So maybe you want to enroll as employee only for medical, but you want to cover your children and your spouse under dental, and then just your spouse under vision. You can do that. So your whole family doesn't have to be enrolled in every benefit. However, any benefit that your dependents would want, you would also as an employee have to be enrolled in that. And so beyond that, I love working with your group. Like I said earlier, I'm always available. Feel free to reach out to me anytime, and have a great afternoon.